Today specifically we'll be taking a blood sample for a complete blood count. So with complete blood count, we test for certain blood indices such as the hemoglobin. So hemoglobin, as we know, is the amount of red cells in the blood that normally carries oxygen around the body, right? So indication for wanting to a CBC with a blood count is to check if a person is anemic, right? Because we know that, for example, young female that are seeing the regular menstrual cycle and probably not eating properly can actually run deficient of the iron, which would normally require to make hemoglobin. So it's actually a purple top tube we use to test for the hemoglobin. All right. Other indications for complete blood count may be patients that have problems with clotting, like if they have like easily bruised, if they have like bleeding nose, bleeding gums, persons that may pass blood in the urine, etc. We also would want to assess their clotting indices, that is the platelets. All right. Also, if persons have infection, the complete blood count again is a purple top tube that we use. The complete blood count would also give an indication of the white cells, and the white cells normally give an indication of how badly a person's infection is, and also can give a slight indication of whether it is a bacterial, a viral, or a fungal infection. All right. So normally we should write the name of the patient on the tube, but we are going to actually do that after the video, since in terms of privacy we don't want to indicate who the patient is. But we normally write the patient name on the tube, and also we would fill out a form which has the patient information, biographic information such as name, age, sex, and date of birth, address, etc. sometimes. Alright? So to demonstrate, this is mainly about blood taking and not necessarily about the theory behind what it's used for. It's just basically a technique I want to demonstrate to like medical students who are probably in their third year rotation, or even nursing students who may be wanting to know how the technique which we use to take blood. Alright? So as we know, blood taking is a non-sterile, it's not a sterile procedure. It's a sterile procedure. We normally don't have to use like excessive betadine. We only need to clean the area with alcohol. Alright? And then take the blood. So normally we should have an official tourniquet to basically tie on the patient like forearm, or it could even arm, or it could even be the forearm. Reason being, when we are taking a CBC sample, we normally take blood from a vein, and as we know, a vein is basically a blood vessel which is going to take back deoxygenated blood to the heart, right? So we have two types of blood vessels in our body. We have the arteries, which take blood from the heart to the rest of the body, and we have the veins, which take blood from the cells or the muscles back to the heart. All right. So as you can see here, we normally have a vein right here, normally called the brachial, well, a superficial brachial vein right here. It's normally a good vein that medical students use to practice to take blood, because it's a large vein and it's easily accessible. So it's both visible, large, etc. All right. So as you can see, when you're opening these instrument, we have a lip here, and we just pull it and open it. So we try and keep it as sterile as possible. All right, and we put the needle and the syringe like this, right? Normally another technique that I use, that sometimes you want to pull the cap a little to have an idea in which to know which side the bevel is, because in all times when you're taking the blood, we should always aim to keep the bevel up. Alright, so it's good to know that when I pull this cap, the bevel, when the bevel is up, I'm seeing like the numbers here. So even when I'm in the person's skin, like in the flesh, I can still know when the bevel is up without trying to guess whether it's up or down. Alright, so as you can see, we clean the area with the alcohol swab, and then I'm going to take the blood. So now we normally tell the patient that it's gonna be uncomfortable and she's gonna feel a stick, right? And then we're gonna go at a 45 degrees angle, and we can tighten the skin a little to ensure that the vein gets a little stiff and firm so it does not collapse. Alright, so now we enter 45 degrees angle and we enter the vein and we pull back the syringe. And for CBC sample, we normally need about 2 to 3 mils of blood max. Alright, so when we pull back the blood, we remove the tourniquet and we remove the needle and the syringe and squeeze to compress the vein, right? So we can either ask the patient to compress the vein, or we could ask her just to bend her elbow for 5 minutes and then we take it. Alright? But just to know that when we're taking a CBC sample, we have to actually agitate the sample a little. Alright? Because we don't want a clotted sample. We actually need a sample that's not clot, because it's actually the red cells, the platelets and the white cells. So we actually don't need the serum, we need the full whole blood itself. Alright? And then as you can know, I would have insert the needle in the top of the test tube. So as you can see, it is designed so we can just insert the needle at the top. But at the same time, you have to be very careful not to be nervous so you don't shake and have a needle stick injury. Alright? Also another aspect in which we can technically cause issues when you're taking blood is when we're recapping. Some doctors will encourage us not to recap, but I find out that this could also technically be an issue to have the needle there uncapped. Alright? So the important thing when you're recapping, if you're recapping, you should just ensure that the cover is on the table or on a piece of gauze, and you just simply insert the needle in and you come on top and push it like that, right? And then normally we discard this in our sharps container. Alright?